My name's Holly Coole, and I am the Safety and Innovation Manager for NHS Supply Chain, and I sit within a specific function called Clinical and Product Assurance, or CAPA as it's commonly known. The function provides the clinical intelligence and expertise in the management of safety-related complaints and in the assurance of products and devices listed on NHS Supply Chain. The safety process within NHS supply chain is important because it provides a framework within which complaints can be effectively flagged to us by our customers in the knowledge that these will be responded to appropriately. The process enables a critical feedback loop which uses the insight of the customer to inform our risk assessment and subsequent actions with the category towers and suppliers to mitigate the risk. Product complaints are raised with the customer services team and subsequently passed to the relevant category tower responsible for the procurement of that device, but also to the CAPA safety team. This enables me to review the complaint in the context of the actual or potential risks that are present. I consider the level of harm posed, including whether this was a near miss, and ascertain the likelihood of occurrence based on the volume of complaints received of a similar nature. The resulting score initiates systems across NHS supply chain in the response to contain the identified risk. This ranges from monitoring right through to initiating the recall of a product, but engages the category tower, suppliers, and end users at all stages to keep everyone informed of the progress and continually monitor the risk. The process is underpinned by the patient safety agenda and more recently the Independent Medicines and Medical Devices Review chaired by Baroness Cumberledge. This reinforces the strategic and national drivers that are being developed with partner agencies such as NHS England, the Department of Health and Social Care, and the Medicines and Healthcare Regulatory Authority in the enhancement of the focus on user safety in the NHS. As a nurse, I've always been mindful of the need to adhere to the objectives and focus of specific policy drivers, but have come from a place of frontline experience. I know how frustrating a lack of practical application from policy is for healthcare professionals and patients. I'm confident that CAPA provide a holistic balance of the policy drivers and practical steps in process to manage and mitigate risk to our users. An example of a product complaint by an end user was a 1 ml syringe with incorrect graduation markings. This hadn't been identified as potential harm. Because I'm cited on all product complaints, I felt this was an inadequate assessment of the risk given the presenting information. I then contacted the customer directly. It emerged that 2,000 of these syringes were in quarantine, not just one, and random samples for all the stock had evidence of the same issue, which was that there were too few graduations on the syringe. This would indicate the potential for underdosing of any treatments or interventions delivered. And this was of particular significance given the incredibly small size of the syringe and that this was being used in a neonatal setting. We immediately initiated a rapid action team across all functions of supply chain to manage the presenting risk. This resulted in the quarantine and recall of the affected stock. This was an example of the efficient management between all stakeholders as the supplier was actively engaged in the recall, recognising the level of risk posed. The supplier was also able to provide assurance to us that no other stock was affected. Ultimately, the safety of the products and devices procured through NHS supply chain are important because at any time we all have the potential to be patients, as do our loved ones. CAPA are a unique function in the procurement model as we strive to ensure that products are safe and fit for purpose.